Hello everyone, welcome to my YouTube channel. I am going to upload the whole syllabus of anatomy including upper limb, lower limb, thorax, abdomen, pelvis as well as CNS. So I have already started with the lower limb session. Our today's topic is posterior tibial artery. We will be learning this topic in 4 subtopics, that is its beginning, course and termination, its relation, branches as well as clinical anatomy. So let's begin with the beginning. It begins at the lower border of popliteus muscle between the tibia and fibula deep to gastrocnemius. So posterior tibial artery is the branch of popliteal artery. So it begins where the popliteal artery ends, that is at the lower border of popliteus muscle between the tibia and fibula deep to gastrocnemius muscle. It enters back of the leg by passing deep to tendinous arch of soleus. It enters at the back of leg by passing deep to the tendinous arch of soleus. This is soleus muscle, deep to the tendinous arch of soleus it passes. In leg it runs downwards medially to reach the posterior medial side of angle between the two malleolus and medial tubercle of calcaneum, where it terminates deep to flexure retinaculum by dividing into medial plantar artery and lateral plantar artery. It begins at the lower border of popliteus muscle, then between the tibia and the fibula, then it passes deep to gastrocnemius muscle, then it runs back of the leg by passing deep to the tendinous arch of soleus. It runs downwards slightly medially to reach the posterior medial side of ankle, midway between medial malleolus and medial tubercle of calcaneum, where it terminates in the flexure retinaculum by dividing into medial and lateral plantar artery. This was the course termination of the posterior tibial artery. Its relation: in the upper 2/3 it has gastrocnemius, soleus, superficial transverse facial septum. In lower 1/3 it is run parallel to 2.5 cm in front of medial border of tendinocalcaneus. At ankle, flexure retinaculum and abductor hallucis muscle. Upper 2/3 gastrocnemius, soleus, superficial transverse facial septum. In lower 1/3 runs parallel to and 2.5 cm in front of medial border of tendinocalcaneus. At an ankle, flexure retinaculum and abductor hallucis muscle. Deep relation: in the upper 2/3 of the leg it is related to tibialis posterior. In the lower 1/3 of leg, flexure digitorum longus and tibia. At ankle, capsule of the ankle joint between the flexure digitorum longus and flexure hallucis longus. Branches: it has peroneal artery, which is the largest branch. This one, it is the largest branch. It has several muscular branches at the back of the leg. A nutrient artery, which is given off to the tibia. Anastomosing branches like circumflex fibular branch, communicating branch, malleolar branch, calcaneal branch, and terminal branches, medial and lateral plantar arteries. Clinical anatomy: the posterior tibial pulse is palpated against calcaneum about 2 cm below and behind the medial malleolus. Case of intermittent claudication, where a person gets cramps and severe pain in calf muscles due to lack of blood supply. So this was all about the posterior tibial artery. I hope you understood the topic, and is there any query, you can do comment in the comment section. Thank you for watching my video.